Hi, and welcome to Verve Plastic Surgery. I'm Dr. Gupta. I know you are here to see me, and I'll be with you shortly. In the meantime, I wanted to show you this video so that you can go over the main concepts that we will be discussing. After this video, I will be with you, and we will discuss any personalized situations and personalized questions that you may have. Okay, so today we are going to talk about breast reduction. Now, whenever we say breast reduction, it primarily does two things. It lifts up the breast and it makes the breast smaller in size. So a few things that we always talk about when we discuss reduction is, number one, the scars. So breast reductions or any breast lift procedure typically has an anchor-shaped scar. There's a scar around the areola, there's a scar vertically down, and then there's a scar in the crease at the bottom. Those are pretty standard scars for breast reduction. Those scars are pretty prominent for the first few months, like 8 or 9 months, but they eventually do fade in most cases very nicely. Number two, we talk about being able to breastfeed. Most patients after breast reduction procedure will not be able to breastfeed. Some patients are able to produce some milk, but typically that's still not enough, and you will have to supplement with formula regardless. Number three, nipple sensation will change after breast reduction. Now, what that change is, it varies from patient to patient. Some patients have one or both sides that may be almost completely numb. Others have a little less sensation, but still have some. And in some cases, actually, sensation does not change and may even improve from before. And finally, there is a rare risk, roughly about 1% of the time, a chance of losing the nipple. Now, that's a rare chance, but in case that happens, then we do reconstruct the nipple, but that nipple will not have nipple sensation. It will just feel like regular skin. It's done by folding your own skin into a nipple shape and tattooing it. But again, it's a rare occurrence. The other possibility with breast reduction also is that one or both nipples may get inverted. That's an easy thing to take care of afterwards, but it's a possibility that that can happen, but it can be corrected with a 10-minute in-office procedure. Now, breast reduction overall is a very successful procedure. Our success rate is about 98%, which means 98% of our patients, when asked if they will go through this whole process all over again, they will say yes. It changes lives. It helps women a lot, not only in feeling better, but also with their upper back pain and neck pain and so on. Now, breast reductions sometimes are done under insurance and sometimes are done as cosmetic procedures. The way insurance companies decide which reduction will be considered medically necessary is based on your height and weight, and based on that, it gives us a score called Schnur score. That number gives us the minimum amount of breast tissue that I have to remove in order to be qualifying this as medically necessary breast reduction. So if your breasts are enlarged because they are very stretched out, but they are not very heavy, you may not be a candidate for breast reduction under insurance. And this is something that I will be able to tell you once I will examine you shortly. So whether the breast reduction is covered by insurance or not, breast reduction procedure more or less remains the same, where the breast is lifted and is smaller in size. Now, there are few areas around the chest that do not see any change with a breast reduction procedure. And I'm going to talk about few options that you have. Those are not covered by insurance, and that's why these will be optional for you. But if you would like to take advantage of those benefits, then you will be provided a quote. So first option is a synthetic mesh, which acts like an internal bra. So even after breast reduction, you will have some weight of the breast itself, and that weight will tend to stretch the skin over time, and over time the breast shape may look saggy again. If you would like to have more durable result and prevent that from happening and have more support of the breast, we can place this mesh under the skin. So you will not be able to feel or see anything from outside, but inside your breast will be supported like having an internal bra, which will be stitched down to your rib cage. This mesh dissolves over time, but it leaves a layer of collagen where the mesh was. So you don't even have any foreign body left in you after about 18 to 20 months, but you will still have an internal bra support that's made of your own collagen. The other part that does not get addressed with breast reduction procedure is any additional fullness on the sides of the chest. That needs to be liposuctioned. So depending on your exam, if you do have some additional fullness on the sides, you may benefit from additional liposuction at the same time. Finally, I would like to talk about one other option, and that is for women who, in addition to have side fullness of the fatty tissue, they also have additional skin, not only on the side, but maybe even in the upper back area. So one other procedure that can be combined at the same time is what is called upper back lift or torsoplasty, where we not only remove the excess fat from the sides, but we also remove excess skin all around the chest. And that gives you very nice silhouette all around. So all these additional procedures are available and are optional, but they do provide a more harmonious look to the chest. The whole chest needs to flow all together. And depending on your individual needs, we may discuss one procedure or all three of these procedures, and you may decide to take one or two or three options depending on your preferences. Breast reduction is an outpatient surgery, which means you'll go home the same day. Typically takes about 3 to 4 hours for me to do this surgery. And you typically go home with some dressings. We'll put you in a bra and you just stay in that bra for the first week. And you will have a drain on each side. And a drain is like a plastic tube that comes out of the skin, kind of at the bottom of the breast. And it's attached to this bulb that has markings on it. And you will need to empty this bulb about twice a day. And you will strip the drain like so, about 4 times a day. And all these instructions are in the packet that you have just received, and will also be explained to you by the nurses in the surgery center or in the hospital. No shower during that week while the drain is in there. You can shower below the waist with a handheld shower, and you can wash your hair and face in the sink, but sponge bath only around the chest. First week is a little bit tough, first 4 or 5 days. So make sure you have some help at home during that time. During that time, you will be able to get up and walk around within the house, but probably will not be going out yet. Your typical first follow-up appointment is 8 to 10 days later. That's when we will remove the drain and will change all your dressings. Once that is done, you will be able to take regular shower. For the recovery, it typically takes about 3 weeks for patients to feel independent, where they are driving and can go back to work and so on. Any more strenuous activities like sports or yoga or gym or swimming, those will be about 6 to 8 weeks out. Thank you for listening to this video. I will be with you shortly. Please think of any questions that you might have. Please go over the folder that was given to you, and then we will go over your specific situation and your questions.